85. A 68-year-old woman presents with a pigmented lesion on the trunk. Upon further examination, the lesion has an irregular border, darkening coloration, and raised surface. An incisional biopsy is performed and confirms a melanoma with a thickness of 0.5 millimeters. The patient is scheduled for a wide local excision of the melanoma in the operating room. Which of the following is the smallest margin recommended for excision? 3 millimeters, 5 millimeters, 1 centimeter, 2 centimeter, and 5 centimeter. The answer is C, 1 centimeter. 86. A 25-year-old woman presents with a benign nevus on the right upper arm. She desires removal and undergoes a clean incision and then closure of the incision without complication. With regard to the healing process, which of the following cell types are the first infiltrating cells to enter the wound site, peaking at 24 to 48 hours? A. Macrophages, B. Neutrophils, C. Fibroblasts, D. Lymphocytes, and E. Monocytes. The answer is B. Neutrophils. 87. A 3-year-old boy is brought to the emergency room after spilling bleach onto his lower extremities. He is diagnosed with a chemical burn and all involved clothing are removed. In addition to resuscitation, which of the following is the most appropriate initial management of the wound? The answer is A. Application of antimicrobial agents, B. Neutralization with weak acids, C. Lavage with large volumes of water, D. Treatment with calcium gluconate gel, and E. Coverage with skin substitute. The answer is C. Lavage with large volumes of water. 88. A 35-year-old man with new diagnosis of Crohn's disease presents with rapidly enlarging painful ulcerations on the lower extremities. Cultures of the lesion are negative and skin biopsy reveals no evidence of malignancy. Which of the following is the most appropriate treatment option? A. Surgical debridement of the wound, B. Topical silver sulfadiazine, C. Topical corticosteroids, D. Systemic steroids, and E. Compressive stockings. 89. Following a weekend of snowmobiling, a 42-year-old man comes to the emergency department with pain, numbness, and discoloration of his right forefoot. Which of the following is the best initial treatment of the foot? A. Observation, B. Refreezing of the foot, C. Rewarming in 40 to 42 degrees centigrade of water, D. Massage of the affected foot, and E. Amputation. The answer is C. Rewarming in 40 to 42 degrees centigrade of water. 90. A 63-year-old man with history of poorly controlled diabetes presents with right leg swelling and pain. The patient denies trauma to the leg and reports it was normal yesterday. Examination of the right lower extremity is significant for extreme tenderness to palpation, erythema, and edema extending up to the knee. X-ray of the right leg shows tissue swelling without gas or osteomyelitis. The patient's vital signs are normal and he started on broad-spectrum IV antibiotics and insulin. An hour later, the patient's heart rate increases to 125 beats per minute and the erythema has progressed to the thigh with new blister formation on the leg. Which of the following is the most appropriate next step in management? A. Repeat X-ray of the right lower extremity, B. CT scan of the right lower extremity, C. MRI of the right lower extremity, D. Bone scan of the right lower extremity, and E. Immediate surgical exploration. The answer is E. Immediate surgical exploration. 91. A 65-year-old woman presents with a 1 centimeter lesion with a pearly border on her nose and a punch biopsy is consistent with a basal cell carcinoma. She is scheduled to undergo Mohs surgery. Which of the following is a benefit of Mohs surgery over wide local excision? A. Smaller cosmetic defect, B. Shorter operating time, C. Lower risk of recurrence, D. Lower rate of metastasis, and E. No frozen sections required. The answer is A. Smaller cosmetic defect. 92. A 25-year-old man is brought to the emergency room after sustaining burns during a fire in his apartment. He has circumferential frank scarring of his right upper extremity with decreased capillary refill. Which of the following is the most appropriate initial management of his right upper extremity burns? A. Observation, B. Eschorotomy, C. Fasciotomy, D. Burn excision, and E. Amputation. The answer is B. Eschorotomy. A 60-year-old diabetic man undergoes incision and drainage of an infected boil on his back. The wound is left open and packed daily. Week by week, the wound grows smaller and eventually heals. Which of the following terms describes the method of wound closure by the patient? A. Primary intention, B. Secondary intention, C. Tertiary intention, D. Delayed primary closure, and E. Delayed secondary closure. The answer is B. Secondary intention. 94. A 60-year-old man with a history of prostate cancer and alcohol abuse presents with perineal and scrotal pain and swelling. His heart rate is 125 beats per minute, blood pressure 90/45, and respiratory rate is 18 breaths per minute. Plain films of the pelvis demonstrate subcutaneous air. He is taken to the operating room for exam under anesthesia and wide excisional debridement. Which of the following organisms is most likely to be cultured from the wound? A. Methicillin resistant Staphylococcus aureus. B. Methicillin sensitive Staphylococcus aureus. C. Group A beta hemolytic Streptococcus. D. Vibrio vulnificus. And E. Clostridium perfringens. The answer is E. Clostridium perfringens. 95. A 40-year-old woman is planned for a wide local excision for a 3 mm thick malignant melanoma of the right thigh. She has no palpable ipsilateral inguinal lymphadenopathy. Which of the following is the most appropriate strategy for assessing for lymph node involvement? A. Observation. B. Positron emission tomography scan. C. Fine needle aspiration. D. Sentinel lymph node biopsy. And E. Superficial inguinal lymph node dissection. The answer is D. Sentinel lymph node biopsy.